Everyone. It is a minute past 12, so why don't we go ahead and get started? Can someone just confirm that they can hear me okay?
We can hear you.
Okay, great, thanks. My name is Jessica Williams. I'm the Director of Practice Support Services here at AHEC, and we would like to welcome you to today's webinar on an introduction to the Advanced Medical Home Tier Support Tool. North Carolina Medicaid and North Carolina AHEC have partnered to ensure that healthcare providers across all 100 North Carolina counties have the information and the support that they need to adopt and thrive under the new Medicaid managed care system. This collaboration produces educational programs such as this one-on-one support by coaches across the state. And the tool that we're about to go over today is just another way that we can support you in preparing for this change. So a quick reminder for everyone to please mute themselves, which it looks like everyone has. Thank you. And there will be designated times during and after our webinar for questions and comments. Feel free to add them in the chat, or you can show your screen, raise your hand. We want this to be interactive. For now, I'm going to hand it over to Nicole Kennedy, one of our practice support coaches, who will be leading the webinar today. Thanks, Nicole.
Hi, Jessica. Thank you so much. Thanks, everyone, for joining us. I am going to go ahead and share my screen with you all. Okay. All right. So hi, everyone. Thank you again for joining us for today's Lunch and Learn. We're going to present a quick tutorial on the Advanced Medical Home Tier Support Tool. This tool is designed to introduce advanced medical home requirements to primary care providers and assess your practice's readiness for Tier 3 participation in Medicaid managed care. Here's just a reminder of the vision of the Advanced Medical Home model. The goal of the model really is to provide a pathway for practices to have a larger role in managing their health outcomes and cost of their members. The program is guided by specific principles to preserve the broad access to high-quality primary care in North Carolina. This program aims to further strengthen the role of primary care in care management, care coordination, and quality improvement activities, and is really designed to provide a path for practices to become more focused on cost and quality outcomes with increasing accountability over time and less emphasis on fee-for-service. Here's just a quick reminder of our timeline. So open enrollment has already begun. It started on March the 15th, and members can now go in and choose both a health plan and who they want as their primary care provider or practice. April 12th is the next really important deadline. It is the deadline for practices to finish all of their contracts in order to be included in the auto enrollment process. You must have a practice contract in place in order to be included in that process. May the 15th is the beginning of the auto enrollment process, in which beneficiaries will be enrolled in a plan. Then members will be assigned to a primary care practice if they did not already choose one during this open enrollment process. July 1st is the last really important date on this slide, which is the official launch of Medicaid managed care. Okay, so without further ado, we're going to talk a little bit about the tool. This tool is provided to function as a readiness tool to help you visually see and organize the steps you will take to get ready. It is also a great way to open the lines of communication with your team and your partners as you prepare for Medicaid managed care. The AHEC team spent many hours developing and fine-tuning the AMH Tier Support Tool, And we hope that you will find that it is a valuable resource for your practice. So let's take a look at the tool. Okay, so as you can see, the tool is set up in an Excel format. It can be downloaded from our website and saved directly to your computer. If you look down at the bottom, we've structured it with several different worksheets that you can work through. The first tab that you come to is the cover letter. Here's an example of a completed cover letter. So as you can see, your basic practice information is listed here alongside of some instructions for the use of the tool. You can add the approximate number of Medicaid beneficiaries here that you can also, by the way, now retrieve directly from your NC Tracks login. Listed below are all of the PHPs that you're contracted with. This practice, for example, has contracted with all available PHPs. Then if you scroll down, you can see that we've included a number of important links to web pages and resources that you're going to find valuable as you begin to move through this process. Next is the timeline. So as you can see here, this is set up really similarly to the slide that we just reviewed, with those important dates listed here for you to take at a glance. All right, so next we get to the printable gap. The printable gap is really here for those folks who like to really have that paper in hand. If you're someone who's going to download this tool and use it primarily in its electronic format, this is a tab that you can really just skip over. But if you're someone who likes to have things printed in hand as a tangible item, this is handy for you here. Okay, so next we're going to move into the front admin gap. The front admin gap and the clinical admin gap are structured really similarly with these standard headings at the top. So as you can see, we have standards listed here along with requirements, practice or CIN responsibility, status tab, rationale, actions reviewed, and over here we also include a due date. As you begin to move through this tool, you want to review each of these requirements and then subsequently decide, is this a responsibility that we're going to assign at the practice level, or is this something that we think would be more appropriate for the CIN to be accountable for? Or maybe you're just unsure, and you can list that as well. Then next you want to assess your status. So if this is a responsibility that we've determined is that of the practice, and we already have the automated recording in place with the ability for a patient to leave a message, we're going to list this as a ready. But maybe we're going to get to some of these other requirements and may not be as confident in it. So we can list it as an in progress or needed, just like that. We also have the actions required box. The actions required box can be particularly helpful if you want to make any notes, list links to resources, or any kind of an action item that you want to list there for your practice to review. All right, so moving on to the clinical admin gap section. So once you've completed your front admin gap, you're going to come over here to the clinical admin gap and review it in much the same way. Please note that on the clinical admin gap, the PCMH crosswalk column has been filled in for you. So if you're a practice who is familiar with NCQA's PCMH recognition process, this may be valuable for you. You're going to review it, you're going to respond to it in much the same way, but you may want to include some of your clinical staff in the review of this section in particular. It can often be very beneficial if you take a team-based approach when you're utilizing this tool. All right. Once both of those sections have been completed, you can review your TST dashboard. This section is designed to be a visual management aid to reflect your practice's progress. You could even periodically print this and post it in some of the common areas to keep all of your staff informed as you move towards Tier 3 readiness. As you can see, completing the ready section in some of the front or in the front and clinical admin gap section is going to reflect a green line here for your dashboard, which can be really encouraging as you go through this process. The next tab is the attestation tab. The attestation tab is really just a review of all of the questions that you already answered in your NC Tracks portal. This serves as a general reminder of the requirements that your practice is held to and can be helpful in assessing your overall readiness. Then we have the project plan tab. The project plan tab is intentionally left blank. This was to allow each practice the ability to really customize the plan that best fits their needs. Your project plan will be unique to your practice and will play an essential role in managing your goals, desired outcomes, and critical next steps to moving your practice towards AMH Tier 3 readiness. We're going to take a look at a completed project plan example in just a moment. The last tab on our AMH Tier Support tool is our Year 1 Quality Measures tab. This tab is here as a quick reference guide to the quality measures that ultimately your practice will be required to report on. This tab will allow you to, at a glance, view those areas that may need to be of greater focus in your practice. Okay, so that brings us to the end of our tool. And here is an example of a completed project plan. This practice has largely structured their plan to mimic the outline of the front and clinical gap sections. We have added in a column for role responsibility in order to make sure that each team member understands the items that they should really be tracking. We've also added a notes section in this example. That can be helpful for adding additional information as you begin to make more progress and move through this process. But again, you can structure your project plan in any way that best suits your practice's needs. Okay, I do want to mention that this assessment tool that's been demonstrated today is just that. It is an assessment tool. There is no expectation or requirement that your practice use this tool, but if you'd like to get started utilizing it, you can download your copy at www.ncahec.net/practice-support/advanced-medical-home. And we're going to provide a copy of that link as well as these slides for you at the end of today's presentation. So if you are a primary care practice and you are in network with at least one Medicaid health plan and you would like some additional coaching support, please contact us at practice.support@chec.net. All right, thanks so much. And I think we're going to leave a few minutes. Looks like we have a lot of minutes left for some questions. If we have any of those coming in, you guys are more than welcome to unmute or pop some questions in the chat if you like.
So I thought I would just add, a lot of times when we're going through the tool, practices will ask about the different requirements that are listed, like, wanting more details. And so the the PHP provider manuals are really, really, really great resource to download if you all haven't done that yet. And we could pull it up and demonstrate, or I can at least put it in the chat box how you guys could access those. But I just thought I would throw that in there. A lot of questions do come around the specifics of the different requirements, and we try to lead you to that resource, which explains that a little bit more in depth.
Jessica, this is Pat, or Nicole, or Jessica. This is Patty. Are the practices sharing this with anybody? Like, are the plans going to be wanting a copy of this tool, or wanting to know what their plan is?
They shouldn't be wanting it. It's really for the practice. But, right now there's the opportunity for Tier 3 advanced medical home practices to receive the glide path payment. And one of those is to, you must be Tier 3 and be ready. And so this kind of walks you through those requirements to make sure you're ready. But there's no turning it in. It's really for the practice. Nicole, did I miss?
Yeah, so it's really meant to be just that, a tool for assessment, and really shouldn't be sent to anyone in particular. That being said, a practice could potentially use the tool in conjunction with their partners. So if they're partnering with an outside organization for risk stratification support or care management support, they could, choose to want to share the tool with them. It is a public facing tool, so it's open for anyone to download if you'd like. So yeah. I was going to go ahead and show you really quickly. This is our North Carolina AHEC website. And if you want to go to the practice support tab on the North Carolina AHEC website, and then over here to the advanced medical home tab, this is going to be where you're going to find your version of the tool. So you scroll down here, and there's actually a download here. So this is how you're going to get access to that. There are other additional resources on this site, such as links to the Advanced Medical Home webinar series and previous recordings and slides from that webinar series as well. So I did just want to share that. And let me see if I can pull up some. So looking back at our tool, if we go to our cover letter again, and we look at some of these great links that are already listed here, you can come to the AMH provider manual, for example. Let's see if I can get it to pull up. Yep, there we go. And it takes you right to the provider manual. Looks like this one is a 2019 version. I think we have one that's updated now. So we'll see if we can get that link updated as well. And then here is your health plan contacts and resource page. See if I can get that to pull up for you. Really just intended to make things much easier for you. So right here, if you want to grab the individual provider manuals, they're listed very quickly here. Takes you right to their manual. And you can look up all kinds of things. So one of the topics of conversation lately has been the language line. And we have heard lots of communication about that. So you can come right to their manual and see what each plan has to say about those services. For example, there you go. That is an added benefit as well. And I can't see the chat, but do we have any questions come in?
I put a comment. It was super helpful to show that on the cover, so thank you. And Mitzi said, thank you, Nicole. This is a helpful tool for sure.
Okay.
Anyone that's on the call, feel free to unmute yourself if you want to see another piece of the tool, have specific questions, or you can use the chat.
It could be beneficial, again, just to say that for this printable gap, I know that this has caused a little bit of confusion in the past with practices or using it more electronically. Sometimes with it being towards the front of the tool, it seems like that's what you should be filling out versus these actual front admin gap and clinical admin gap sections. For those of you who, again, are electronic, just skip this tab. But if you're not, and you want to print this, you can actually go here and just make sure that this part of your settings says active sheets. So that can be a helpful tip sometimes in printing that information. Also, in the Year 1 Quality Measures tab, there's additional information here about a November 5th fireside chat. And if you all are not tuned into the fireside chats, I'd really encourage you to take a look at some of those. The team at DHB and Dr. Dowler do a wonderful job presenting you with timely information. And that has specific information related to the final AMH quality measures. So that November 5th, and it can be found on our AHEC website as well.
Hey, Nicole, there's a comment in the chat about the location for the tool again. Could we potentially go to the AHEC website and show them where they could download this?
Sure, absolutely. Okay. So this is our, again, this is our North Carolina North Carolina AHEC website. The page that I'm on right now is actually a link to former and current webinars that are taking place. But if you come here to the home page and you click on practice support and advanced medical home, so you're going to click on that and it takes you to this page. So it's the practice support advanced medical home. Then scroll down to right here. So looking for the AMH tier support tool, download here. So if you just click that, it downloads right there, pulls up pretty easily. And this is the way it looks when you first pull it up. I will say that when you first download this tool, it can sometimes look a little bit different in the, there we go, in the front admin and the clinical admin gap sections. For some reason, it just pulls up really shrunken. It's like at 40%. So you just want to bring that back out to 100 to be able to read it. So that's going to be the way that it actually pulls from the site itself. And yeah, so it does it on both of those sections. And then as you can see, when you initially download this item, it's going to have everything listed as an in needed. So you'll just go in as you review these different requirements and change that status to whatever is appropriate for your practice. Okay. Hopefully that was helpful.
Yes, thank you. There are no more questions in the chat.